Hey Reluctant Preppers, you could have been watching this video the moment it came out
by going to healingyourself.life and subscribing to our new sister channel, Healing Yourself. See you there.
Hey Reluctant Preppers, you could have been watching this video the moment it came out
by going to healingyourself.life and subscribing to our new sister channel, Healing Yourself. See you there.
Does your family ever get exasperated with you for stockpiling such things as paper towels, bottled water, or toilet tissue? Well, they certainly can't object to you stockpiling money. Silver, the only money recognized by the U.S. Constitution, and your first 10-ounce bar of pure silver can be had at spot price with no premium by going to sdbullion.com/rp. And when you buy it that way, you'll be supporting Reluctant Preppers as well by going to sdbullion.com/rp. Thanks. Hey, Reluctant Preppers. If you haven't heard, we've already started our monthly 1-ounce U.S. Silver Eagle thank you gift to one active Patreon subscriber each month, signed by your host, Dunnigan Kaiser. And you don't want to miss out on that.
Please help us grow by subscribing today at patreon.com/reluctantpreppers.
HealingYourself.life provides information for awareness, educational, and support purposes only and does not diagnose or prescribe treatment for any medical condition. Viewers are encouraged to do their own due diligence and consult with their own medical caregivers before making personal treatment decisions.
Welcome back to HealingYourself.life. I'm your host, Dunnigan Kaiser.
And I'm Melody Kaiser.
We have a first-time visitor with us. Our guest is Elaina George MD. She's an ear, nose, and throat specialist out of Atlanta. She has her own radio show, Living in the Solution, and she's the author of the book, Medicine, The Cost of Corporate Control. We're glad to have Dr. George here with us. Dr. George, thank you for joining us here on HealingYourself.life.
Yes, we're very excited to have you.
It's a pleasure to be with both of you.
Thank
you got our attention on several of your recent appearances, one of which was with Carrie Lutz on the Financial Survival Network and also on Finance and Liberty and some other channels. And you have been a outspoken advocate for years now for reducing the cost of healthcare and improving service to ordinary people, to the patients, for their health and wellness and well-being, which is supposed to be the purpose all along. But there's so much conflict of interest out there. We're hoping tonight you can talk to us and to our audience about what is going on with the runaway, skyrocketing costs of healthcare, and what are the forces that are driving that, and what do we need to do as individuals to take care of ourselves and our families so that we don't have to be basically victims of this system that seems, determined to feed on itself until it eats the host and leaves us completely out of help altogether.
Well, I think the other interesting point you made, and I think that patients, us, don't realize the situation doctors are in too, so I think we can, maybe you said to touch on that, but because doctors are in kind of the same situation that patients are. You're being really, your profits are really going way by not that you got into the business of being an MD for that, but you also do need to make a living, and that really the insurance costs and the high cost of just being a doctor is, as I think, maybe what you're saying, and correct me if I'm wrong, is chasing many good doctors out of being a doctor. Is that
I would agree with that.
Okay.
Yeah, it is. It's not just the cost, but it's also the scope of practice. I went to medical school in New York. I went to Manhattan Eye, Ear, and Throat Hospital for my residency, and I was blessed. I was trained at one of the best universities and medical schools, et cetera, in the nation. And I did cancer care at Sloan Kettering, pediatric ENT at New York Presbyterian, my surgery at Lenox Hill Hospital, and when I left practice and opened my own, I found that I couldn't actually perform the things that I was trained to do. I no longer practice pediatric ENT. I no longer do head and neck surgery. I no longer do ear surgery. I trained 6 years for these skills, and I no longer perform them because the reimbursement rate was so crazy. It's not compatible with keeping your practice open. I had to give it up, and I'm not alone. So what we've had now is a brain drain, really. I'm in solo practice, one of the 30% left in private practice, and I'm not able to take care of my patients in a way that makes it affordable, accessible. I have to send these patients to the university hospital, and they charge 10, 15 times more than what I charge as a solo practitioner. So what we've seen is a shifting from the affordable side of healthcare to the artificial structure in the corporatized healthcare system. And the Affordable Care Act really empowered that at the expense of the doctor and the patient.
Right, and that wasn't supposed to be. Whether that was really in the first place.
I thought it was written by the medical industry.
I think it's probably the medical insurance industry wrote. Yeah. So it is a shame. Do you have any hopes that Obamacare, the
Affordable Care Act?
Thank you. The Affordable Care Act will be dismantled, or is this something that we Americans are going to have to live with and find out our own path of how to find good health care
work around that
at an affordable rate?
Actually, there is a parallel system that's come online since the Affordable Care Act got passed, and it's driven by the consumer-driven healthcare system. That means price transparency. That means going to an independent doctor, freestanding independent surgery centers, labs, radiology centers. There's a two-tier system. Those who stay in the healthcare market where they're using commercial insurance, Medicaid, Medicare, they're paying a heck of a lot more and getting a heck of a lot less compared to those of us who use our pocketbook and our consumerism to access the healthcare system. It's really tragic because now you're paying more and you're literally getting a substandard level of healthcare. Doctors are leaving that side of the practice, or they've been replaced by mid-level providers such as nurse practitioners and physician assistants. And my thing is, just need to follow the money. They've been brought online. Affordable Care Act literally paid for training for nurses, and they did not pay for training for doctors except for hospice doctors. So I should tell you a lot about what the Affordable Care Act was designed to do. It's not about healthcare. It's about control, and it's about centralizing the delivery of the healthcare system. And I believe deciding winners and losers. And unfortunately, they sold it with, if you don't have it, you're going to die. So they pull on the heartstrings of everybody. But they really did that in order to gain control. Remember, it's a sixth of the economy. And if the government controls that, that's you paying into a system that literally will work against you and make you comfortable until you die. And that's really unacceptable.
Wow.
We've certainly experienced, and I'm sure a lot of our viewers have as well, the disconnect between the cost of the actual wages that you receive and your buying power versus the cost of so-called healthcare. I don't even know if I can call it healthcare. I guess I could call it medical system, the cost of the medical system to the average person. Because what we found as we learned more and more about that, we kept paying higher and higher premiums, getting higher and higher deductibles, and then the coverage wasn't even covering the things that we were starting to learn that were actually going to preserve wellness and health for our family. And so we ended up having to do on our own, pay to go buy the right kinds of supplements, or the right kinds of herbal treatments, or the right kinds of healthy lifestyle, or whatever was all on top and above and to the side of what we were also paying. So it's like you're just paying into the system for the system's sake and not for your own sake. And I wonder, you've been so close to that and you've studied it so well, if you can just help to put some specifics behind that, what's actually going on.
I think you had it right. You nailed the nail on the head essentially at the beginning of the introduction when you said the Affordable Care Act wasn't written by doctors. It wasn't written with the patients and doctors in the room, the ones that actually practice medicine. It was the corporate entities that stood to gain. So you had every lobby entity represented, whether that was the insurance industry, big pharma, even the unions were involved, and the AMA, which I might say only represents a fifth of the practicing physicians, and I'm not one of them. It's a lobbying group, and it's all a money-making entity. And I recently found out that it literally is a money-making entity for Congress, because when they give their money for their various pet projects, they're giving it to Congress folks who use it to get the next round of elections in. So they're literally working against us because all you really have to do is follow the money. And as I said initially, it's not about healthcare. You said it right. I'm a big natural and integrative medicine component, or a proponent, I should say. I'm a surgeon, but I don't want to operate on everybody that walks in. I want to fix the problem. I don't want to treat the symptom, and I don't want to drug people. But the way the system's created, it's designed to have a doctor spend 7 minutes, write a prescription, and next. And if you don't write the prescription, you actually may be removed from the system by becoming a disruptive doctor and be removed under peer review. this is how bad it is on our end. I told you about me limiting my scope of practice, but one of the reasons I stopped taking Medicaid and Medicare, specifically Medicare, was because they had a rule that stated that if I underbill somebody, that means I don't charge them what I'm allowed to charge them, it's less. That's fraud. And if I do it 3 times, I'll be jailed. That was when I said, I'm done. I have to get out of the system, because if I try to help my patient, they'll take me out of business. And it was against the Hippocratic Oath. I'm not here to drug people. I'm here to help them. I'm here to be an advocate for my patient, not an agent of the government. And then the electronic medical record system, which all sounds awesome. It's not. It's basically a data gathering entity. And we have to put in things about if you ever tried to hurt yourself, if you have a gun, if your child thinks he's a boy or a girl. These are all social justice type of questions that they're asking us to answer in these electronic medical records. And you cannot close the chart unless you answer the question. So it's a treasure trove of data. And I've learned from colleagues that one of the most important things that we have, literally, is our medical data, because it doesn't change. And they'll know everything about you based on that. Your financial situation can change, you can move, but your health data doesn't. And it's a gold mine. And doctors are literally, and nurses, anybody in the healthcare profession, are all here to try to gather the data for whomever. And I really had a problem with that too.
Right. And I wanted to you had mentioned the American Medical Association. For many people may not know this, but they are the second highest lobbying group in the nation. For whatever reason, the Pentagon is the first, which is like, it's by the government. Why would they even have to be lobbying? But they're the first, and AMA is the second. So I didn't know that really they didn't.
A little bit about the health and well-being of the patients. What do you believe for the good of an ordinary person should the system look like if the patient's real needs was going to be the first priority instead of all these other priorities?
How does it look like?
Well, I think you have to, again, the mantra is follow the money. Whoever has the pocketbook has the power. If the government or the insurance company via the government has you paying them, and then they decide what the care is, you're really on the hook. Because we're in a system, it's a fraudulent system, honestly. You pay a premium and you're supposed to get health care. I sign a contract, and if I deliver health care the way they say I'm supposed to, follow all their pre-certifications, I should be paid. It doesn't happen that way. The patient gets denied for medically necessary, what they deem to be medically necessary. They'll not tell you the price of something, have you have the procedure, then pull a rug, and you end up being bankrupted because of it.
That's
It's
right.
just
That's what we just went through. I had to get the iron infusion because of some anemia, and I worked for hours and hours, day after day, talking to the center where it was going to be performed. And I got up to the manager of their entire oncology practice, who said, I don't have any idea how I would get that number for you. You've got to get these certain codes from your doctor, and then you can. And I was running out of time, and so finally I had to go in and get the procedure, and I got the bill afterwards, and for 2 doses of IV iron, the bill was $21,000. And they said, there's nothing we can do about that. And then the insurance company had them knock it down to $6,000. And I was able, with hours and hours of more conversations, to get it down to like 20% off of that was their big concession. And then there's a different physician-led and physician-organized cooperative practice in our town that does the same thing for about $1,000. And it's just like, now wait a minute. And the exact same brand name iron too. So,
yes,
yeah. This is the problem. There's no price transparency. So the bigger, the more corporatized the entity is, the more money they charge. And there's nothing stopping this. They have something called a facility fee. And this is some arbitrary fee that they just tack on because they can. There's no value to that. They just tell you and you're just stuck with it. And the sad part is they own the equipment. So you're paying for use of the equipment that they already own. Then you're paying for the reading of the test. You're paying for the time it takes to do the test. You're paying for everything, and they're jacking up the price on every single thing. The first thing I would say, and I know we're going to get into how patients protect themselves, is to think like a consumer. If they can't tell you what something costs and you're not in an emergency situation, then you need to shop around. And the first thing you can do is go to a lot of websites. Mine is one, drelainageorge.com. I have links to other websites that you can go as resources. There's one called jointhewedge.com, and they have a listing of all independent doctors across the country who have a direct care practice. That means they tell you what the cost is up front, no hidden fees. And if you want, really in privacy, all the doctors on that website do not use electronic medical records that are attached to the system. So everything that goes on in that office is locked. Nobody knows your personal information, because you really need to be aware. If an electronic medical record is given and it's on the cloud, anybody can access it. And we already know with the Affordable Care Act, the FBI was accessing it. The IRS was accessing it. They had to prove that you actually said that you were making a certain amount of money so you can get your subsidy. So they were checking you from money perspective and your word. But who else had it? You know what I mean? Who else can actually access it? Right. So again, your health information, which is the most valuable thing you have, has been sifted through God knows how many times. I don't even tell you how many times they have a breach in a hospital. So if you're really sensitive about that, a direct primary care on Join the Wedge would be ideal for you. Then there's American Association of Physicians and Surgeons, which is the antidote to the AMA. And that's the national national organization that covers independent doctors. And they're all about patient care and practicing the Hippocratic Oath, very patient-centered. There's a list of doctors across the nation who take cash, barter, like I barter in my practice as well. So there's lots of resources, so you don't have to be stuck in we don't know. And if you have to have a surgery, there is a website called Oklahoma Surgery Center of Oklahoma. And it's, as it says, it's in Oklahoma, but it lists all its surgical prices online. And it includes the surgery, the anesthesia, everything as one package. And if there's a problem, I think they also cover that if there's some sort of, you have to go back for surgery. But it gives you the ability to say, I know how much a gallbladder surgery should be. I know how much a tonsillectomy should be. And if they tell you it's $15,000 for a tonsil and it's 2, then you can say, sorry, meet the price or I'm not having it done. And you have so much power as a cash-paying patient. You'd be amazed. They will drop the price. They will work with you. God forbid you have to be admitted to a hospital. After you get out of there, I would get a copy of my bill, go through every single item, make sure they didn't double bill you, make sure you had the thing done, and you'll be amazed again. There's mistakes, I'm sure, I hope, but you get a lot of things knocked off your bill if you're just conscious of being a consumer. They expect you to be dumb. They expect you to say, oh, I'm stuck. Woe is me. Please, throw yourself on the mercy of them. But honestly, they know they're robbing you blind. But they don't play around with people who know what's going on.
That's very interesting because we knew a couple, he actually worked for the hospital, but they billed them a delivery room charge when she had the baby in the elevator. And she didn't make it. And he fought and tried to fight that, and he never won. He still had to pay, and he worked there.
Wow.
Yeah, that was, and so I thought that was just very, very sad for them. But these are very good ideas. But I think that is if you do need a surgery, there are hospitals that also will do cash, or?
Well, the thing is to stay out of the hospitals. That's the key. You need to be on an independent side. Surgery Center of Oklahoma is independent. There's locations in Florida. I mean, there's listing. They'll be able to actually guide you to independent surgery centers. I mean, if you have to have open heart surgery, etc., you're probably not going to go to an urgent care. However, there is something called the Cayman City Islands. They have Health City Cayman Islands, which has cardiac surgery, orthopedic surgery, dental. These are doctors who were trained in the United States, but they've gone back and they've opened up a practice outside the country. And that includes everything, the surgery, the post-op, the staying there, etc. And it's a fraction of what it costs in the United States. So there's plenty ways to do this. MedRetreat is a really great website. Okay. It's an American-run company that literally will get you to places like Health City Cayman Islands, or even here in the United States, works with locations that give you a cash-based discount for surgical care. So you can do medical tourism, and that's another way around this system. But just doing the same thing, expecting to get a good deal, you have to work at it a little bit.
When you mentioned earlier that bad things happen when the power of the consumer is taken away by a centralized authority, it really rang true for me. There's been people who have talked about this in the past, that whenever the government not only gets involved but takes over something, generally you'll see costs will go up and you'll see quality go down and choice go down. I'm thinking like of higher education. Once the federal government came in and said, okay, we're going to provide all these guaranteed student loans, and all of a sudden it's like the gravy troughs of money opened up. It sounded like a good thing. Oh, now there's going to be more access. More people are going to be able to afford higher education and so on. And what it became was this pipeline of money out of the pockets of individual taxpayers to the government. Now the government's in control, and the businesses are just, again, the cost of higher education doubling and doubling and doubling, whereas people's wages haven't, because there's that guaranteed payer, and you no longer have to satisfy this individual consumer. But the other insidious part about it is that the control over your self-determination over your own life gets taken out of your hands as a consumer. Not only are you not permitted not to pay the tax, but once you pay the tax, you're not permitted to have influence over how that money gets spent, and you're basically a slave to that system. And it sounds like the same thing is happening in the medical area as well.
You just said a mouthful. I absolutely agree with you. It's debt slavery. But in this way, it's worse because it's about your health. Now imagine if they end up getting single payer. It's already bad. They're not doing a thing to lower the actual reason for the cost.
No. And
the cost is the corporate structure, the third-party payer. And my thing is, I really think, when I think about this critically, single payer for us, if we, God forbid, ever get there, won't be like England. It won't be like Canada. It'll be like Medicare Advantage, where you'll have one insurance company being the administrator, them making buku profits, and then you being forced to pay, and I mean pay, double, triple the taxes that you're paying now to feed that beast. And then they're going to deny you care. It's going to take you longer to get it. So, there'll always be people who are more equal than others, because I can foresee Congress will exempt themselves from it, just like they did with the Affordable Care Act, and we'll all be stuck in this mire of supposed health care. And the flip side of it is, once you get single payer, then I foresee them saying to physicians, if you want to practice medicine and get licensed, you will be taking this insurance, or you won't be practicing. So we'll be co-opted into this as well, against our will, and it's just going to be a disaster. I don't even want to think about that, because I will no longer practice medicine if it ever comes to that. I refuse to do that.
Yeah, that's important. I remembered my question. It was from back when you were talking about the patient questionnaire, and we actually had some friends who refused to answer whether they owned a gun or not at home, and you can refuse to answer all the answers. What happens to the doctor when the patient says, "I'm not, you don't, that's none of your business"?
That's a good question.
Okay.
If they're in a hospital setting, you really cannot close the chart. I guess they'll have to make up an answer, because you can't literally, close it. It won't let you.
Wow.
So you can't skip the question. You got to answer it one way or another. But then again, here we go with medicine. It's about the doctor-patient relationship, and it's about honesty. So how many patients are now not telling the doctor that, hey, I do some recreational drugs this week, on the weekends, or they're not telling you what they do because they don't want it to be known, and you give them a medication and you end up giving them an issue. I mean, there's so many domino effect here, because it should be about honesty and safety and privacy. And all those three things are gone because it becomes about money and control. I think if the pharmaceuticals had their way, honestly, they want people on more than one drug every day for the rest of their life. And they'll be taking medicines for the complications of other medicines. It's ridiculous. Mm-hmm. It's a system. And they train doctors to go along, not know anything about supplements. And it's really funny, of the doctors that I know, and I'm one of them, who believes in natural treatments if you can do them, it's always because we had a family member or something personal that happened to us that it didn't work and we had to go outside the box, and it worked. And then you start going down that path, and you're like, this is physiology and biochemistry. Why am I recreating the wheel with something that's artificial when it's all about nutrition? But they don't want to do that either, right? So we supply the vaccine industry, you name it. We could be a lot healthier than we are, if you really want to be honest.
Yeah, I believe that. And one of the things that really catapulted us into doing things more naturally, our son had asthma, and we tried the conventional medicine, and he turned violent. He was only 4 years old, and he told me we were in the grocery, and he was in the grocery cart, and he said, "I'm going to break your fingers." And he was 4 years old. And I was like, okay, there's something wrong here. He never acted this way. So we knew we had to find a different path and a different way to heal him. And we ended up doing that. We ended up finally, we tried some homeopathy, but then we tried a constitutional homeopathist, and it cured him. Absolutely, he doesn't have asthma anymore. So it was incredible. So we've learned, and that's, I think, the hard part for many of us, and including us, is that how to break free from conventional insurance and be able to go to the kind of insurance you have when we already have a pre-existing condition. For my husband and I, we have Lyme disease that we're dealing with. It's chronic. Not that the CDC recognizes that, but we have chronic. And so do you know of insurance companies that will take us on, like the Liberty Health Share, or do we have to be free from any disease, or how does that work?
Liberty Health Share is not an insurance company. It's actually a membership. Okay. It started off as one of the Christian sharing ministries, and I think there are 3 or 4 more others. Full disclosure, I joined Liberty Health Share. I like their mentality of thinking outside the box. When I joined, I talked to them about, I like integrative stuff, and I like to do energy medicine. I think it should be covered. And they listened to me. Wow. So they actually cover alternative treatments, and other Christian sharing ministries didn't do it. So that's one of the reasons that I joined. And that's the beauty of a membership. It's about the members. If we all decide we don't want to do something, or we do want to do something, it changes. The ship changes course. Good luck. With the commercial insurance getting that done, it's not going to happen. And it's not about nobody being ill. The founder of Liberty Health Share has diabetes, so he's very acutely aware of people having medical conditions. And I think there's a big conflation with having a pre-existing condition and not being covered. They make it sound like no one ever gets covered. Most people have a pre-existing condition, asthma, diabetes, high blood pressure, you name it, but it's managed and it's controlled. Those people get coverage. They're not denied coverage. The problem is the folks, and I have to tell you, from a Medicare perspective or Medicaid, God forbid you get diagnosed with a catastrophic illness, they'll bankrupt you before you get covered. Is that fair? Nobody talks about that. You have to give up your house. You have to get rid of your bank account. You have to sell everything before Medicare will cover you, or Medicaid. So give me a break. I see folks every day with medical conditions who have healthcare coverage, whether that be commercial or the Christian sharing ministry. So that fear statement, it's all about driving people to stop thinking and then run to help from the government. Let's be honest. Most people have health, so it's not a problem. And Liberty Health Share, if you have a condition that is not controlled, then you can come in as a probationary member, and they'll work with you to get your blood pressure under control, get your weight down, get your sugar under control, so you can join as a full-fledged member. That's the only folks who don't come in immediately. But if you have a health problem and it's controlled, nobody's going to deny you.
Oh, that's great. Okay. Very interesting. And I think that is this whole aspect of fear, and I think that's what has kept us in thinking, well, we have to at least have this other health insurance, even though we're trying to do other alternative stuff that obviously the conventional health insurance does not pay for. No. So it's like there's that fear rather than, okay, we can let go of that. We can let go of that traditional insurance because it's not going to help us. And the other health insurance is really going to give us not only health, but take care of us as well. And I think there is that.
Specifics, actually, so you get numbers. The Liberty Health Share for an individual over 30, it's like $250 a month. For a family, it's like $449, family of 4 and up. The total out of pocket is $1,000 per individual per year. Wow. I think it maxes out, at $2,000 for a family. And that particular model, that particular plan is called the complete plan. So once you pay out the $1,000, everything's covered up to $1 million per incident per year. So
that's
if you
better than health insurance.
Thank you. And I can tell you, I put my office staff on it because I couldn't afford to cover them under commercial insurance. One has had back surgery. One was in the hospital with chest pain, in the ICU, had to have an ambulance. Everything was paid for. So I can tell you personally that it does get paid for. And then they had chiropractic stuff that got paid for, allergy, sinus surgery. So, it's all about being able to access the system on the cash-based side. Because people ask me, how do you cover this many things? Because they're not paying the insurance inflated price.
Yeah, once
right?
you cut the several middlemen out who are, then there's more left for the actual purpose of what it's all supposed to be for.
Mm-hmm. Absolutely.
Wow.
It's interesting. When I'm a technical professional, and when I was interviewing for jobs about a decade ago in Minnesota, one of the places I went to was it's one of the nation's largest insurance companies, but they also create information systems for insurance companies. And I interviewed there. I talked to some of the people that work there. I interviewed them. How do they like working there and everything? And it was really like, I remember reading like modern literature, like Franz Kafka novels and stuff in college, where you're in this impossible to understand complex system that's so big anybody in there doesn't even think that they know how big the whole system is. They just know their little part of it, and they're just building these huge databases and servers and huge everything just for its own self. And I came home and I said, eventually we're going to pay all of our money for nothing, and the system won't care. It'll just go on by itself, because all it does is just feed on itself, just getting bigger and bigger and bigger. And that's even not talking about the control aspect of it. That's just talking about the conflict of interest of the profit motive that these insurance companies and the information systems companies for the insurance companies and the politicians who are being bought into office so that they can approve all this money. There's a huge conflict of interest and the drug companies. Sorry, I forgot that one. On everybody's part. Right. And where's the patient? Oh, come on, they're just to feed. They're just to feed the system.
Well, and it sounds like it works that way with the doctor too. You're there to feed the system rather than I'm here to take care.
I totally agree with you. I just came back from a conference, and one thing I didn't learn, I learned something new that I didn't even know. The pharmaceutical companies have something called a kickback, an anti-kickback statute, safe harbor. And the pharmaceutical benefit managers and the general purchasing managers, the GPOs purchase for hospital, and the PBMs purchase for the pharmacies. They actually have legal kickback. So they'll give a price from the insurance company. It's an inflated price, and they each get a kickback from it. And that money that the hospital gets is being used to pay their CEOs. Imagine that. And then the lobbyists use their kickback to pay Congress. So they're getting money from the lobbyists from us.
Yes.
So it's like all this inflated pharmacy cost on our backs, and they're using it against us. It's just tragic, and it's legal. I was appalled. The best way to do this is not to get sick, honestly. Withdraw your consent. Stop doing things that are not appropriate. I understand people do some crazy stuff, but really, if you can eat organic, it's much cheaper in the long run to eat organic than it is to eat the crap, excuse my French, that they have out there. If you can grow it yourself, grow it. If you can get clean water and stop drinking fluoride and get a fluoride filter, then do it. $250 to buy a system under the sink. And I got one that's like 18 or 19 stages. I can't even drink the water in a regular tap now. My cat doesn't even drink it. But seriously.
Yeah, our dogs don't either.
We have exactly the same thing.
We
reverse osmosis.
Yeah,
And we give it to our dogs as well, yes.
Yeah.
But imagine buying all this plastic water, that's a lot of money per year. You could just save your money and just, maybe don't go out to dinner a couple of times a month and save your money. But you have to have personal responsibility, honestly. And you have to stop depending on someone to take care of you. The government doesn't care about you. If you don't care about yourself, how do you expect other people to? And unless you take your power back, they will take advantage of you and take your money and say, and what? I just choose not to do that.
So in the case of the medical premiums that many people like us feel compelled to pay to get so-called traditional, it's not traditional. It's just, It's the modern medical insurance and medical system. If to opt out of that, what steps can people consider that will still leave them adequately protected in case of things that go against them?
let me give you a couple of choices. One, now the mandate is gone. So the Trump administration has gotten rid of that. So you no longer will be fined or dinged. That's awesome. I talked about the Christian Sharing Ministry, and I can tell you what I did and what I've done for my office.
Please.
Liberty Health Share is one. So we have that as our base. And we added AFLAC as our supplemental insurance. Okay. So the AFLAC policies that we purchased were for cancer care, ICU, ambulance, kidney disease. I bought one for dental. So now I have, for like $80 a month extra, I'm going to get God forbid, a $250,000 check written back to me, no questions asked, based on a crazy diagnosis. That gives me a lot of power on top of the $1 million per incident, that I can take care of myself, not be dependent on going and selling my house and stuff and going into Medicare to get treatment. I don't have to do that anymore. And it's not an insurance plan, it's an indemnity policy, which means once you buy it, it's yours. They're not going to deny you. So all you need to do is have the code, and they'll pay you. We get paid for going for routine wellness checks like colonoscopy or mammograms. They'll give you a check back, $60. It's better than nothing, just to stay healthy. So these are the things that keep you from, I can't afford it, so let me not do it. And then you can get treated before things get out of hand. These are the things that you do preemptively. And my opinion is, if you can control your pocketbook through this process, and it's not coming from a second source or a third party, then you have so many more options. I can do medical tourism. We can go to any hospital in the country. There is no panel because we're essentially self-pay patients. So if I got to go to Sloan Kettering, I can. If I have to go to MD Anderson, I can. I can go to the biggest hospital. But I can tell you, if I do go, Liberty Health Share will be there to negotiate that price. And they're not paying what they're going to charge me. Even though my out-of-pocket's $1,000, my group, there's over 300,000 members right now in the country and growing. They're not going to get dinged with some $1 million bill. They're not paying it. So this is the way you put brakes on the system. That's one method. The other is direct primary care. There's a growing number of doctors in our country, independent doctors, who will make a deal with you for a flat fee per month. It'll cover everything that goes on in their office. $60 on average for an individual, up to $120 on average for a family of 4. And you can see them 4 or 5 times a year. If they have to do EKG, blood work, chest x-rays, all covered in the $60 a month. And you have 24-hour access to them, so you're not in some urgent care getting, ripped off. And you have a relationship. So if it's something not right, you can call up your doc and say, hey, I got to get in tomorrow, and you can get in. But this is the key to this system. It's about time. So you could spend a half an hour with your doctor. They're not shoving you out the door in 7 minutes. And that's one of the reasons I think the healthcare system is so bad. If you don't have time, you can't ask questions. You can't get to know your patient. You only can do one thing, one problem at a time. Yeah, you're going to get a prescription in that kind of system. But when you can actually give the nuances, I spend an hour with a new patient, a half an hour with an established patient. I'm blessed. I made a practice that works for me, and I decided I'm going to be small, I'm going to be lean, I'm going to make sure it's patient-centered, but I knew that going in. But now I have a group of doctors around me that I can send patients to who think the same way. That's where patients need to find their care, with us. And if you go to the independent doc, you're already ahead of the game. It's cheaper, better, it's more efficient. It is personalized care, so it's not one size fits all. And you're going to get stuff caught early, so you're not thrown into a system where you just become a little fish in a big pond where they're just trying to take everything they can get and then put you in a hospice.
Right, so that you can die. And
yeah, and that's the other thing that's so insidious in the government-controlled system and the corporate-controlled system is that it's really misrepresented as being more access to more options, and it's going to be provided for more people. That you mentioned the heartstrings earlier. There isn't a time that I haven't heard about. We've got to approve, the universal care or whatever it was because there's so many uninsured people. We got to get them on the rolls. They deserve it too, and that sort of thing. But that seems like that's the front story. That's the narrative. The real deal is to gather in all the money from the taxpayers, maintain the control, and then pay it out to those who are on the take, and the patient actually just falls through the cracks.
You get it. And let's look at Medicaid, for example. There's a disparity in the delivery of healthcare with the minority community. You know what? I wouldn't even say minority. I'd say anybody who's working or working poor. They are not getting the same care as everybody else. And I've worked in clinics as an ENT where I'm seeing 30 people a day, and I have children come in to see me, and they're on every psychotic medication that you could possibly be on. 2-year-olds, 3-year-olds, because they're just getting medicated into oblivion. That is not appropriate. And you can imagine how these little children are going to grow up with their brain being fried by all these medications because they have a question, or they're inquisitive, or they just wanted to be zombies. That's not appropriate. No one ever talks about that. But there's a whole group of our country, the working poor and the working class folks. They are really getting the short end of the stick, and the seniors. So the second group that they just totally screw over. There's no reason why seniors should be on medicines, so many that they fall, break a hip, and then end up in a skilled nursing facility because, someone can just medicate them. Or they put them on so many meds, and I've seen this too, where they're on the same type of med, but like 3 different versions of the same med.
Wow.
So their blood pressure drops through the floor. I mean, the things that we see on the front line are tragic. And I think getting more of that is not the answer.
Yeah, I totally agree. It is appalling to me to think that, and I think it was another person we had on talking about not only kind of the connection between our food, and you talked about eating organic, that the food that we're eating is making us sick so that the drug companies can try to make us well with their drugs. And it's like, no, that's not, and he was saying how we can't do that. We do need to eat organic food as much as possible and try to take care of ourselves. But I think it's hard for the working poor and sometimes the elderly who I think grew up trusting that doctors were there to help them, and now not just over-medicate them because there's those, and I didn't realize it's not just a incentive on their part because the drug companies are paying them to do it. It sounds like they're also being told they need to use the drugs. Is that right?
Well, a lot of folks think that doctors get paid to write a prescription, et cetera. That's not what goes on. Okay. We don't get paid to order a test either. You're right. If we're independent, I'm sending a patient for a CT. I'm not getting any money from that. I'm just trying to get information. Now, the doctors on the hospital side, that may be a little bit different, although it's not a one-to-one, but they are paid by the hospital. So if their salary is based on the hospital doing well, yes, there may be a peculiar incentive when they order a test. But I don't think they're ordering it just because they're trying to make money. So I want to put that out there.
Yeah.
But, it's kind of a catch-22 in a way. Ultimately, what goes on in the physician's office is based on training. And the pharmaceutical companies are the ones that underwrite a lot of the medical training. And think about the word evidence-based medicine. This is not a word that I grew up with or trained with. It's new. And evidence-based medicine means you're treating patients based on what the pharmaceutical companies have come up with. Who do you think underwrites these research, things that go on? When I was a medical student, having a blood pressure of 120/80 was normal. It's now high blood pressure. Cholesterol used to be 250. That was normal. Now that's abnormal. You need a cholesterol medication. Being obese, I think the BMI was 30. Now that's morbidly obese. So they've changed the numbers in order to make more people sick so that you need to get a prescription. And I'm hearing stuff like you need to pre-treat children with anti-cholesterol medication. So this is how they've co-opted the system. And any doctor who questions that and says, why don't we try diet? They are laughed out, or they're removed, or they're peer-reviewed out of existence. So that's another reason that you need to stay out of the hospital setting, because the pressure to conform is so high. And I have to tell you, it's affecting my colleagues beyond measure. 400 doctors are committing suicide a year since the Affordable Care Act passed. So we're not happy. We're not doing this because we want to. We're under duress. It's killing the practice of medicine, frankly. And you can help us by going to doctors who don't subscribe to that. it's all about the money. If we stop feeding the beast, it'll stop eating us, basically.
Wow. So enlightening. Oh my gosh.
There's so much.
Yeah.
As you're talking, I'm sitting here thinking, okay, there's a topic. Oh, there's another topic.
Yeah,
we're
well,
going to
we'll
have to have you back on
yes,
again because you just
I'd be happy.
surveyed about 8 major topics there that we're going to have to explore in greater detail.
Yes. And I wanted to just make sure, when you said your website is Dr. Elaina, is the doctor spelled out or is it Dr.
It's DrElaina, George like the man's name.com. And my radio show, it's called Medicine on Call, but it will be changing to Living in the Solution. But you can find it on iTunes and Stitcher and all platforms.
Great.
And my blog is also on drelainageorge.com. I've been writing about this for years. So I want people to be educated so they can make an informed choice.
Well, Dr. George, we just
gosh,
thank you so much for joining us this first
Yes,
time on
so
Healing
enlightening.
Yourself Life. I know our audience is going to be eager and hungry for more in so many areas that you've opened up there, and we're just so grateful for you joining us here, and look forward to having another conversation with you again soon.
Yes, thank
I'm
you
looking
so
forward-
much.
Thank you so much for having me. I really appreciate it.
Yep, thank you. To learn.
There's so much that's so wrong.
Yeah.
And
yeah.
I know.
it's almost too easy looking around to find things that are seriously wrong about this. And if people could just conceive, and I think most people get parts of this, but most people just, we're led to believe there is no other way, there is no other option, it's just the way you got to do it. But everybody feels that sense of just withering self-control, withering freedom, and being just more and more really stuck feeding the beast. Yeah, absolutely.
Well, I'm here to tell you there's another way.
That's
So
just
it's the
great.
good part.
Cool.
Yeah, because
Cool.
it can save. I mean, we feel that the financial burden of really trying to live, having two healthcare options, and so we do go to 2 independent doctors at the moment, and they don't take insurance, but it sounds like Liberty Health Share would really benefit us,
Right.
and pay for that. So
If you're putting up information for me, put up libertyoncall.org.
Liberty,
And-
okay.
Yeah, that will be the website. And then the number would be 800-714-6993. And it's amazing. It sounds too good to be true, but honestly, when you know how rigged the system is and they're just not playing the game, you get it. And then you just add other things so you can totally be covered, because they actually offer medical tourism through Liberty Health Share. They get it. It's all about what the member wants. So it's independent. It's all about the individualized approach, not one size fits all. It's so much better. It's not even it's not even a joke.
That's exciting, because another one of those topics that I thought, okay, we're gonna have to come back and talk about that, is people who are getting, and our demographic of our culture is getting more and more ready to retire aged people, but they feel like we can't retire because we gotta keep affording this health care. I gotta keep calling it health care. It's not health care.
We
It's the
actually
medical
have
costs.
some friends. He retired early, and they decided they can't afford it. He went to work at a hospital locally here, and so that
half time, just so they could have benefits again.
So they could have benefits, but he only has to work there 5 more years, and then he'll get this health insurance policy or whatever. But too bad they didn't know about Liberty Health.
Yeah, right? He should be enjoying his time. Now he's just putting it in so he can be covered. That's just tragic.
Yeah.
I mean, I think the administration is making some good changes. The health association plans, the health savings accounts, which are supposedly now going to be unlocked, so you can use them for what you want and not just insurance plans. So I mean,
that sounds good.
I go for policy and give them ideas as well. I'm part of a group of docs, so we've been trying to work with them so that we can put the power of the purse back with the patient and not the stupid insurance company. And it's starting to come slowly but surely. I think the administration is getting rid of the anti-kickback rule, so they're stopping that.
That's good.
And that will be a big, big blow for freedom, because they won't be able to gouge folks anymore. It might cut off their gravy train, but so what?
Right, exactly. Oh my gosh.
Also, the Congress should have to have use the same plan that everybody else is
you.
They
using.
really should. Yeah.
Yeah. Okay. More topics than we can shake a stick at right now.
Oh my
Thank you
gosh.
so much, and
Yes.
we will reach out again. Very good.
Great.
Thank you
Awesome.
so much.
We had such a fun time.
Soon.
I'd be happy to come back.